So we're going to go ahead and we're going to get started to respect everyone's time. Thank you all for being here today. So hello, everyone. In the name of the National Latino Behavioral Health Association, the National Hispanic and Latino Addiction and Prevention Technology Transfer Centers, we welcome you. My name is Ana Chavez Mancias, and I am the co-director for the National Hispanic and Latino ATTC. Welcome to the second session of a two-part series titled Understanding Risks and Cultural Factors Contributing to Substance Use in Hispanic Latino Immigrant Youth. I will be your host for today's presentation. Next slide, please. Before we introduce our amazing presenter, here are some brief instructions about our event. Here's the information about our grant. You will receive a copy of this presentation so you can read the content at your own convenience. Next slide. This session will be recorded and archived for future playback. A copy of today's presentation will also be made available. The lines will be muted throughout the presentation to minimize background noise. When we get to the Q&A portion of our webinar, you will have an opportunity to ask questions by clicking the Q&A box, and we will share your questions with our presenter. We will also be asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work that we do and provides us with the opportunity to improve our training efforts. A certificate of completion will be sent via email at the end of the webinar. Closed captioning is available for this event. You need to activate your screen by clicking the live transcript button at the bottom of your screen, then choose to show subtitles. Next slide, please. We would like to take a moment to reflect on the power of words and remind you that together we can use our words to create positive change. Next slide, please. Here is the TTC network map with information about the Addiction Prevention and Mental Health Technology Transfer Centers. Each network is comprised of 10 regional centers and 3 national centers. The network coordinating offices, National American Indian and Alaskan Native TTC, and the National Hispanic and Latino TTC. Our centers has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Next slide, please. Please allow us to introduce you to our parent organization, the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit and is located in New Mexico with the mission to influence national behavioral health policy, eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino population. Next slide. NALBA's objective is to provide national leadership on mental health and substance abuse. Concerns of the Latino community, NALBA policy priorities are selected capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of behavioral health professionals, funding for co-occurring disorders of alcohol and substance abuse, opioid crisis in the Latino community, and suicide prevention. Next slide, please. Our team is staffed by Dr. Susie Villalobos, who serves as the project director for both centers. Priscilla Jamesi is working as the project coordinator for the National Hispanic Latino PTTC. Cristina Mancibo Torres is the program specialist for the National Hispanic and Latino PTTC, and I am the co-director for the National Hispanic and Latino ATTC. Next slide, please. Now it's time to introduce our amazing presenter. Diana Padilla is a research project manager in the New York State Psychiatric Institute, Division of Substance Use Disorders at Columbia University Medical Center. Ms. Padilla provides intensive technical assistance in 2 organizational capacity building initiatives, the implementation of SBIRT, a screening, brief intervention, and referral to treatment, and the integration of equity and inclusion strategies to improve service delivery and address behavioral health disparities for marginalized communities. Both projects are facilitated for the Northeast and Caribbean Technology Transfer Center, Region 2. Ms. Padilla also chairs the National Committee on Behavioral Health, Equity, and Inclusion Committee for the Addiction Technology Transfer Center. The working group focuses on disseminating the application of class standards and other related topics and technical assistance initiatives to help organizations address disparities in behavioral health. Ms. Padilla is also a senior trainer with more than 23 years of public health service, introducing behavioral health practitioners, prevention specialists, and drug court professionals on addictions and recovery supporting best practices. Diana, thank you for your ability to share your knowledge and your experience with us. Please feel free to start your presentation. Thank you.
Thank you so much, Anna. And thanks everyone for being here. I'm honored to come present with you wonderful providers and professionals here at the National Hispanic Latino Addiction and Prevention Transfer Technology Centers. This is really building on a series that's already started that was presented by Dr. Cervantes, and I am hoping that a lot of you folks have attended that particular training. If you allow me, what I will do is, before I segue into the SBIRT topic, which is really, this is entitled The Migration Informed Context for Delivering Screening and Brief Intervention and Referral to Treatment, or what we many of us refer to as SBIRT, the shorter version, with Hispanic and Latino immigrant youth. And this is very, very specific. It is about, the context actually focuses on the framework that we are encouraged to use when we're facilitating an intervention or process that is already proven to be effective with this population. And so this is extremely important in terms of being able to address some of the emerging issues that we have been seeing and that has been spoken to in terms of the challenges for communities, particularly immigrant youth, Hispanic, Latino immigrant youth, transitioning into the Western culture and to our hemisphere here in the United States. So the focus with youth here is primarily on adolescents. So those are the ages between 12 and 17. But some of the content can also have implications for young adults. Young adults are sometimes referred to as the older adolescents, and they tend to be within the cohort between ages 18 and 21. And to some extent, if you're more familiar with SBIRT, it also has relevance for adults. What I'd like to do is, before we talk about the practice of the processes, understand what the lay of the land is right now, and segueing off the presentation that was that Dr. Cervantes did on the 5th, which is really important to helping us understand why are we going into a screening and brief intervention referral treatment process. And so with that, I would love to ask folks to pull up, to think about a poll that we're going to present to you now. Can you bring it up? There we go. So in order of use, we're asking you folks to actually check in on here and see which substances are consumed most by adolescents in the order of which you think they use it. So just choose any one of the 4 options. Does someone can let me know if the responses are coming in? Fantastic. So we see that a lot of folks have picked tobacco, marijuana, and alcohol. It's a good 26%, and there has a few folks that have picked the opiates first, and that might be relevant to folks who are providing opioid use disorder specific treatment for the adolescent population. We also know we have a nice amount of folks who are saying alcohol, marijuana, and tobacco, and 30% are doing marijuana, alcohol, and opioids. And thank you for that, and that's fantastic. And let me tell you, we can close the poll now. the actual correct answer right now with the current data that's come out, which is interesting when we have data that's current for 2022, is the first one. It was actually tobacco, marijuana, and alcohol. And there was a time where the choice would have been just pre-pandemic days, alcohol was the first substance that adolescents were known to indulge in the most. But that has changed. Tobacco comes first, marijuana, and alcohol. And so what we see is, and there's a lot of references here are looking at what the school settings are presenting. A lot of the research has been done there. And so what we see is that among eighth graders, a good 7% of eighth graders going into this level of education are actually vaping. And so, and had reported that they have vaped in the last 30 days of when the survey was conducted. And so there was more of a lesser 6 and 5% perspective in terms of marijuana and then alcohol. And then by the time they get to 10th grade, you have an increased amount of folks who are vaping. More than 14% of vaping in the have vaped within the last 30 days of having been asked these survey questions. And then an increased rate also with tobacco and alcohol. And by the time folks get to 12th grade, you start to see even higher numbers. And I have a graph to show you about that. And so these substances most used by youth, one of the reasons why I'm discussing this first, because it's important for us to understand before we start talking about the immigrant youth, to understand what are the youth, what does it look like now in terms of substance use, in terms of other potential issues? Because we do know that adolescents do tend to form alliances with other peers. And so understanding what the community might look like, where they might touch base with when it starts connecting is pretty important. So some of the substances that we do know that the youth are using, what they're doing, the tobacco research has really been reflecting how much vaping is being done. While it's nicotine vaping, there's other dangers with that because these electronic cigarettes do present health issues in terms of ultrafine particles that may be caught up in that vaping process when they're inhaling. You have the cannabis use or the marijuana use. That's the pot, the smell, depending on what the words or the references, the terms used by the community that you're working with. You also have alcohol use, which stays pretty relatively high. And there's always such a concern when we know that with youth, and remember I was referring to anywhere between 12 and 17. So when we're talking about adolescents, and we know that the legal age to access alcohol is 21. So it's not just so much that they're pretty resourceful, it's the fact that they are consuming at risky levels. And so that and other illicit substances and prescription medications, other than heroin, there's other things like the prescription medications like OxyContin or Percocets. We do see, I'm going to show you something about having to do with opioids, but we have seen quite an increase within youth that have been misusing medications. So alcohol use, you can see here over the lifetime, according to the different grades, and this is referring to maybe some of the information I just presented was, with the eighth graders, you see a 25%, 46%, 61% over the lifetime, but over time, what you see is the frequency of use. And so it starts to increase as they grow older, as opposed to diminishing. I also wanted to show you about youth who use opioids in the past year and some of the data. This is really from 2020. Most of us are very familiar with those overdose death rates that have occurred. Well, opioid use disorders has increased not just in different cultural populations, but has gone even higher with youth. And so thinking about that, let me just show you this. Some factors. So if we understand that the lay of the land, the environment that immigrant youth are coming into already has certain situations that are high risk for some youth. in this country already. So I'm thinking of that, it makes sense for us to consider the segue, the transitional process, the acculturation processes for immigrant youth as they come into this country with different elements and situations that puts them in those opportunities to actually engage in substance use and other behaviors. So some of those factors that increase the risk of substance use for immigrant youth is worth looking at. So it was spoken to before about acculturation and stress. And psychological acculturation, it refers really to the processes of, what groups go through what they experience when they are leaving the world that they know and they are coming into a new environment and trying to understand how to adjust to that new environment. It has a lot to do with leaving behind the social and cultural values or belief systems, practices, what they're used to knowing. And then if you think about folks who are 12 to 17 years old at that very young age, and you consider how dramatically different, how impactful that process can be, all by itself, just them being in this new environment. And we think about the stress that comes along with having to acculturate, with having to understand how other kids behave, to understand what this world, how to navigate through the world. So acculturated stress refers to those stresses associated with being an immigrant or an ethnic minority and going through the acculturation process. And so some of the characteristics of some migrants include understanding that the countries of origins and the type of migrants and where they come from, what are the push and pulls that kind of propel someone to go into this country. There's a lot more than just transitioning and adjusting to the Western culture that is involved in this. And so when we think about, say, Hispanic, Latino immigrant youth, so a lot of us think about, those border crossings. So a lot of undocumented immigrants often experience trauma to various degrees of the migration process. And so you want to consider that when thinking about how the youth population, the Hispanic Latinos coming into this Western world and understanding how to deal and cope with that stress and the traumatic experiences they may have had traveling into this country. And so some of the push and pulls that I have mentioned before may be when you think about what propelled family members to either go through to the financial issues or the sense or the escape from violence or the political oppressions or the threats or disasters they've experienced as having the poverty. These are all big reasons, causatory factors for folks to actually take a risk with a very arduous journey of travel when it comes to leaving their places of origin and to come into this country. Also think about what trauma stresses can be during that process, during that journey. Perhaps some of them might experience the violence, some of them might be witnessing the violence. The environmental hazards, not being able to maybe have enough food or enough food as they're used to, maybe water limitations and physically having to push to go further. The abandonment and the separation issues is a really huge issue. It's a really huge concern when we're thinking about adolescents and the attachment theories in terms of development and being the traumatic impact of leaving what youth had already known to be familiar to them to come into something very different and not being able to be with their parents. I'm thinking about the children that do come in, that they are asked to travel with either someone that they don't know or some other person other than their family member, like that parent, that sibling. And so the separation issues that can come from that, witnessing death along the way. Not everybody survives these journeys. So what about after the trauma and stress of after arriving, limited resources given their status? Some of these relocation centers have to follow a certain process, and new immigrants have to go through certain protocols. And that in and of itself can be very traumatic for a lot of folks, particularly when you have a lot of kids coming together, a lot of families, strangers sometimes, not everybody knows each other, and coming into an environment together, being penned up in certain situations, in certain buildings, in certain settings. And so given the status of not having the freedom or having to go through these protocols, the stress from adjusting to the new environment is going to underscore everything we speak about today. But exploitations, the fear of being deported, after going through all that, we have seen and have reported, have documentation about many people who have come through, many Hispanic Latinos may have come as far as Bolivia, some places in South America, up through the Mexican route into the border to get through to the other side, and have attempted it many times before they were finally able to get into the country. And so the risk factors that come, the trauma and the stress of having to do that, of having to witness that, is higher, especially amongst those who are younger. It's a lot more traumatic. And so, of course, that kind of brings us to this point. And I believe it was mentioned last week. And so most of us are familiar with the adverse childhood experience, I believe. And the ACE study was something that was conducted many years ago. And what has been so prominent about this research study is not as much that it was 17,000 participants that were followed. It is the correlation that was identified with children who had witnessed or had been exposed to adverse experiences at such a young age, when they're not fully developed, when they're not completely processed, being able to have healthy information processing functions in their minds, when they have endured sexual abuse, physical abuse, emotional abuse, or they have witnessed it. And what that has done is just has shown how much more likely they are to grow into adulthood and have a lot of other issues. So when considering the link between trauma and substance use for migrating adolescents, it extends a lot of times from a lot of the research is showing from the age of 9 well into their 30s. And so what we see here is a higher likelihood that males and females, and that children that have been exposed to these experiences will have a higher likelihood of having disrupted or arrested development, like we say sometimes, all types of psychological impairments, emotional impairments, the increased risks for health, are more likely to be prone or higher propensity for disease and mortality. And so the ACE studies are really foundational to us understanding how trauma and stress and our acculturating stress and other issues that are very relevant and prevalent within the travel process, within the adjustment process, within acculturation, how that relates to substance use and putting Hispanic, Latino immigrant youth more at risk. So here with trauma and substance use, many of us understand that substance use increases the vulnerability for trauma, and trauma increases the vulnerability for substance use. So when considering the link between these two with adolescents, we want to be able to assess and identify potential traumatic exposure and potential correlations and segues into substance use. Substance use disorder can develop after trauma anywhere between 25 to 75% of folks, or so for some folks, the onset of PTSD can be likely for up to 59% of people. There's a lot of reasons why people use substances, but sometimes when you think about developmentally, when the developmental issues with youth has a lot to do with, peership, alliances with other peers, and how relevant is that when you want to feel a part of, when you want to be accepted, and you're in a new environment. And so if you're coping with different things and you're offered or you are exposed to opportunities to use substances, you may want to ensure that you have that peer alliance, and you may be able to manage your own stress symptoms by using substances, whether it's alcohol or marijuana or smoking cigarettes and so on. One of the things we all are familiar with is that the adolescent brain is consistently developing. Like I said earlier, well into the early 30s. And so the toxic effect, the toxic impact of different substances, it doesn't matter whether it's legal or illegal, is the fact that the brain is developing and maturing, and alcohol and other substances can have really huge neuropsychological impairments from a variety of different levels. So youth who engage in alcohol and other drug use, and this comes from Conrad and Helton. This is one of several sources that I have at the end of the slides that we put in there for your further research. And they do a lot of screening, brief intervention, referral to treatment with the youth population. And so we do note that, and many resources have noted that youth who engage in alcohol and other drug use at younger age have a higher risk for lifetime negative personal, social, and health consequences, the way we speak to in the ACE study. One of the things that I wanted to bring up here today, which I think is important for us to kind of keep on our radar, so to speak, is cultural bereavement. It is the current term for an emerging issue, particularly with refugees and immigrant youth. I don't want to be derogatory using an inappropriate reference, but these are terms that are used with a lot of settings and systems that are in place to try to help folks who are not documented to come in and process them into the United States. So one of the issues I've been presenting is cultural bereavement. And that has to do with someone who actually may not even realize it, but may be grieving their experience from having to be uprooted or being taken out from their familiar environment and going into an unfamiliar environment. So that acculturation process, that travel, that journey, all that happens along the way, and also letting go or not letting go or dealing with the separation of what you are familiar with, what you, especially at a young age, whether it's the family, whether it's the school system, all of that is especially important. It's coming up these days, is being referred to as cultural bereavement. And hence the correlation between that and substance use, because we know that a lot of times when, especially with younger folks, when there's opportunity, the coping skills are not necessarily matured. They're not necessarily, they haven't necessarily been developed in healthy ways. And so an opportunity to escape can present themselves, and after substance use comes into play. So the younger the individual is exposed to stress, we already know about negative health outcomes. And there's a lot of dysregulation of stress responses because the person may not have has yet to learn those healthy coping mechanisms. The other opportunity that shows up is the accessibility to other substances. And depending on where, in different geographical areas, different states have their protocols where Hispanic and Latino immigrant youth have been coming into different areas, and they're being processed and they're being transitioned into the community. And so a lot of times during the developmental stages, we also know that peership is pretty important for development during development time. And so when some of the communities present with opportunities for accessing substances or drugs, the opportunity to be able to do as other peers to kind of get along, to be accepted, it may be a means of coping. And so it can just exacerbate the trauma, stress escalation, and all other issues that kind of present with a lot of adolescents, Hispanic, Latino adolescents that do end up transitioning into the US. So some of the things, so all of this is to say, it's all of it is to really kind of promote a culturally appropriate trauma-informed framework. I want to speak about how we can frame the screening, brief intervention, referral treatment, but I also want to suggest a certain thought in all of your minds. If you're working with youth, if you're working with Hispanic or Latinos, particularly those who are just transitioning into this country, using a culturally appropriate and trauma-informed and linguistically conducive framework is key to any strategy, any process that you use, particularly in terms of engagement, and particularly in terms of thinking of all these other traumatic and risk factors and likely adverse experiences that the Hispanic adolescent immigrant may have, is more likely to present with. And so some of the benefits of a migration-informed approach is that, especially the the approach that I'm going to speak to is using a person-centered approach. Now, person-centered approach, we know this very much. Many of us, whether you're clinical or non-clinical, being able to meet somebody where they're at and understand from their perspective how to best engage them, how to have a conversation, how to best meet their needs, it's essential. The research has been showing forever how effective this approach is. And so the strategy we're going to discuss is a person-centered approach. So it has that component already involved in it. Culturally and linguistically appropriate strategies are key. When you have Hispanic and Latinos who are coming into this country who are not, are still dealing with the fact that they're separated from their parents, who may be looking to see other kids that look like them, who may speak like them, that is particularly important in terms of providing some type of comfort and safety. It's not just the cultural piece, but the language piece. When we're speaking to Latino immigrant children, and we're asking questions, we are processing them through the different established protocols here in this country. We have to ask them in English. In order to be able to identify potential issues of trauma and stress and potential other risk factors that might put them in a position to use substances and the other separation issues and the other potential experiences that they have had, being able to speak the language is a wonderful way and very, one of the most relevant ways where you can engage a youth. And that can start to create a rapport and potentially a healthy alliance or a healthy way of engaging. And so engagement opportunities are key. And so many people might be able to might come into this country, and children might come into this country and may be able to speak English just enough to kind of get by, just enough but not necessarily have the comprehension. So asking questions, and engaging them in a way that is more culturally appropriate, speaking the language, maybe having representation, on staff that are actually doing the initial engagement can be very effective. So, and then we're going to speak about the efficacy of the intervention. So one of the things I'm going to ask you folks for change something. I am going to bring this up. I'm going to ask you to please put your comments in the chat box. So I want you to consider how important a trauma lens may be, or is it relevant or not relevant in this particular situation. Consider for a second, just for a moment. You have folks, you have youth, you have, they may be 12 years old, they may be 14, 13 years old, and they are in a setting, they have been housed and they're placed in a housing and they have meal services, but they include entrees that combine more than one food group, not necessarily something they're familiar with. The adolescent may refuse to eat and claim that the food choices are limited. Perhaps they convey that to you. What we want to understand is, do we initially have this first gut feeling comes up, the first idea comes up is that we perceive that they refusing to eat and avoiding certain foods because they have either an eating disorder, or is it a behavioral issues? So we want to be more objective and really address uninformed ideas, or perhaps even our biases, I dare say. Using a trauma lens, what might be factors of consideration worth exploring with the youth that may not necessarily want to eat the food? What do you think that might be about? And I'm specifically saying trauma. So please put your answers in the chat box. And with your experience, just share on your chat box what you think may be going on. I'm going to give you my perspective here. So, okay, make the food culturally appropriate. Maybe, yes, not familiar with the food. We can also think about different things. Child refuses to assimilate to new foods. Maybe the foods are new. If we are facilitating the transition of youth, especially youth, into this country, are we giving them food that they're familiar with that they will eat? A lot of malnutrition is evident and has been reflected in the documentation and research with the Hispanic immigrant youth that's transitioning into this country. So we don't want to jump to conclusions. We want to really look at use a trauma lens and start to think, well, what else is going on? What else might be going on here? Feeling lonely, missing parents, let me see. El lenguaje es muy importante, pero la cultura es fundamental. Aquí en los Estados Unidos somos diversos. So pretty much what the gentleman is saying is language is really important to be able to elicit information. So what foods does this person eat? Unfamiliar environment, not trusting, lack of control. Would be good to talk about the food that they consume. But you know what? And here's the thing, a lot of our situations, so many of us who will be or have been working with this community, with the immigrant youth, Hispanic, Latino community, we know the language is really, it's an important factor in engaging, but it doesn't stop there. You want to engage, give them a situation or a setting where they're more familiar, so they're more likely to be responsive to the information, to the questions you're going to elicit information from them before or with. Also think about, what did their world look like before? What is familiar to them? Because if we use a trauma lens, we could probably anticipate that just the journey alone, it's impossible to, pretty impossible according to the research, to think that anyone just took the journey and it wasn't tactful, impact in some kind of way. But with all the other issues that tend to present, we want to be able to build a safe environment where folks feel comfortable. So yeah, so the adjustment period to the United States, we want to be able to understand what kind of foods do they eat. Is it that? But I'm also going to give you another potential perspective. Yes, I like the colors and the smells could bring up past traumatic events, even recent traumatic events. So here I'm going to suggest that maybe we can also think about being just culturally trauma aware with this Hispanic, Latino, and youth immigrants. So one of the things that you want to factor in is that the way they get here. And the way they get here really helps us anticipate that there's likely trauma and high levels of stress. And all kinds of behaviors can result from that. So using a culturally trauma-aware perspective can change our assumptions. So instead of jumping to a particular assumption or conclusion, let's consider, what kind of experience of neglect might this child have had before? Is it possible they were abused on their journey? Is it possible they're leaving the abuse from their place of origin? While traveling, reacting to the fact that there is no familiarity, that there's no one that looks like them, that people are talking to them, their mother's not with them, they don't see their sibling. We have had children. I see there was one center in that I'm familiar with a colleague of mine who works in New York, and she spoke about within a week how they processed 3,500, and I thought that was a lot of days for 3,500 immigrants who came through. 800 of them were children, and the majority were unaccompanied. And so when we consider how to engage, when we consider trying to help them transition and not to exacerbate potential mental health issues, not to exacerbate conditions that might increase with that transition, we want to be able to use a culturally or a trauma-aware perspective. Thanks, everybody. Those are really, really good responses. So as we go forward, cultural principles are really essential. Cultural humility is really an important part of the work we do with Hispanic and Latino immigrants, with the Latinx youth that comes into this country, particularly when they are fleeing or they're being pulled for another reason coming to this country. How we approach them is very important. And so cultural humility really speaks to a process that is other person oriented. It's really about reflecting back on ourselves. If we're going to work with this diverse community, we want to be able to check our biases and our sense of privileges. We are citizens, and many times we're working with the undocumented community. Children are coming on their own. We need to understand how to elicit information from them, not push them away, and have them retrieve mentally and physically into their own world, which can exacerbate any kind of mental health issues and certainly put them at risk for substance use. But we want to be able to engage them to better support them. And so it's really, so cultural humility in practice is really about listening information, not thinking we know everything. We might even look like them, and we might think that we know a lot. We don't know them. Until we ask that child, until we are able to engage and elicit specifically for them their experiences, we cannot assume that they are all right, that they should be able to respond to our questions, that they should respond to directions, that they should be able to eat the food that we put in front of them, and so on. So it's really about us being culturally responsive in the services we provide and approaches that we use. And that's all about, being respectful and relevant to the beliefs and practices that they're used to. What are the cultural and linguistic needs of the Hispanic and Latino immigrant youth? Super important when we're doing this kind of work. So I want to speak to applying the Maslow hierarchy, establishing a needs assessment with cultural humility lens. Thank you for that. And so now I want to speak to you about the language. When you're talking about engagement, so again, these are different. First of all, so when we are thinking or we're about to screen someone, when we're thinking about doing any kind of strategy, what's the environment look like? Are we being culturally appropriate? This is essential for this community, particularly these children. So the language we use is important. And I tend to stress this because over the years in our expertise, in our education, in our settings, we have evolved with our experiences, we have evolved in our language. One of the things we've been stressing, and many of the national and state resources have been speaking to for the last many years, even just before the pandemic, there was a huge move to speak to using stigma-free language. And that's recovery-oriented language. So let's think about potentially maybe Spanish or the dialect of the language, because we got to understand that not everybody speaks Spanish, which if staff is able to speak that language, understanding what words do not carry stigma with it is also important. When we're speaking right now in English, I'm just going to make a reference here. When we're thinking about screening for substance use, there is a certain dialogue that I'm using these days, and that SAMHSA and NIH, a lot of other large entities encourage us as professionals to use with the communities in need. This is particularly important for children who have been traumatized or have been impacted by a variety of different negative experiences. And so what we want to do is be engaged. And so thinking about substance use, it's very specific to the consumption of psychoactive substances. So when we're having this conversation, substance use is not necessarily a term that's going to push people away, which is a big difference from when we say substance abuse. And substance abuse almost seems to speak to as if a person has a choice into indulging and using substances, and that the progression of the addiction moves on only by choice. And so it really kind of eliminates all the science and all the data that and all the experience that we know. So substance use, it's a healthier way, less more recovery-oriented way of engaging someone if you have to use it in the context of a conversation. At-risk substance use refers to consuming at levels resulting in harmful, hazardous consequences. And so this is pretty important because when we think about screening, brief intervention, and referral treatment, or SBIRT, a lot of times what we're trying to do, particularly with the youth, is we have an opportunity to be able to identify and intervene at a point in their life where we can obstruct potential progression to a substance use disorder. So at-risk substance use, I want us to consider it like that as well. I'm going to show you a graph about that. Substance use disorder is really about a particular criteria that a person meets and gets the diagnosis of a substance use disorder. And so if you think about the potential progression of substance use, and someone might start at the left side of this graph. What you see is, where folks, especially youth, are looking, may come into experimental use. That's part of development. Early stages of development include, trying different things. Social use, maybe thinking about the alliance or that peership, that allyship with other peers, which is pretty important to be able to feel like you fit, to feel more comfortable in your environment because you have other people your age that you can connect with. And so that we can easily see how folks may try different substances, but the general idea in society, in the larger community, is that either someone doesn't have a problem or someone doesn't have a problem. The substance, they actually, now you need treatment. So here we're talking about someone who actually meets the criteria of substance use disorder. What we don't always look at is folks who are on this trajectory and this progression of use, where they may be binge using or misusing, where they're starting to do more, starting to indulge more than just experimenting. And so this is really an opportunity, and particularly with Latino immigrant youth who are just learning and transitioning into this country, this is a really opportunistic time of development and of their transition to be able to have a conversation with them. And so that's where screening, brief intervention, and referral to treatment, or SBIRT for adolescents, comes in. So I wanted to ask all of you, how many of you, and in your chat box, please type Y if you have heard of SBIRT before, and if you have not. If you've heard of screening, brief intervention, referral treatment as a model, okay. Many people saying yes, some people are saying no. Oh. So there is some yeses, some no. Okay. So for those who did type the Y for yes, how many of you actually use it in practice with youth? Okay. Very good. So we have some. We have a lot that are not familiar or are not using it with the youth population. And here we're suggesting, we are certainly encouraging you to use a migration context, a cultural framework to be able to do this with, considering all the other factors that this community experiences. Okay, thank you for those responses. And that's okay. You know, screening, brief intervention, referral to treatment, which is interesting for adults, is still not, it's not familiar to a lot of people, much less for adolescents. But we've seen the research, we've seen opportunities, we've seen the efficacy of the strategy, and that's why we're speaking to it here today. So here, let me speak to what it is. So let's define what the SBIRT intervention model is. So screening, brief intervention, and referral treatment is comprehensive. It's a public health approach. It's a very integrated strategy to be able to identify early on and intervene and treat individuals who may add risk for adverse consequences of alcohol and other substance use. And this is in general. So what we're knowing, what we've been doing, and with the research, and many scientists across the country have been doing, they've been using this with adolescents for a great many years. And again, like I said before, you will have the resources available to you. What is important for you to know is that the American Academy of Pediatrics recommends that pediatricians become familiar with adolescent SBIRT. What I will also note with you is that you don't have to be in a medical setting in order to use it. Any non-substance use treatment setting is ideal to be able to use this approach. Particularly if you're speaking Spanish, if you're engaging in a culturally appropriate and linguistically conducive way, this provides you an opportunity to be able to engage youth and be able to elicit information, be able to intervene with them if they're currently at risk for substance use and other issues. And so why are we doing SBIRT is because the psychoactive substances, we already spoke about the impact on the brain that these psychoactive substances have. Stages of development, we know that they're at a very high period of vulnerability. And so early intervention, just like early substance use, increases the risk for those issues and more into adulthood. We also know that the earlier you can intervene, the more likely you're able to obstruct those processes. SBIRT for adolescents can potentially obstruct the progression of substance use, and studies have shown that SBIRT is effective for this population. And so when we're talking about the Latino immigrant youth, we're thinking about when we use a cultural framework, not only can it work with them, it can really help them transition. And so here are there's some studies that have shown the efficacy of SBIRT with adolescents, you know, whether the brief intervention, how to have that conversation. Remember, we were using a person-centered approach. We're using a cultural and linguistically informed framework, we are using the migration context and all the potential traumatic issues that may be part of it. So we're using a trauma-informed approach. Trauma-informed care and culturally and linguistically appropriate strategies align so nicely together. It doesn't need to be separate. It really should be part of the same perspective. And so here you have a lot of studies that kind of, at least some of them, that kind of speak to the efficacy of SBIRT when it's done with adolescents. So some of the components here. SBIRT, so is this a tips of paper screening? Actually, I want to go over the screening now. These are different instruments. These are validated instruments that have been developed very specifically for the youth population. Very important to let you know that it can be self-report, for youth in general, but when you're thinking about the Latino immigrant just arriving, language is key, and maybe either self-reporting in Spanish or the dialect that they speak, or doing a person-to-person interviewing. And so the SBIRT core components is the screening and it's the brief intervention referral treatment. So the screening should be done universally. There should be not one person targeted or identified very specifically, and not everyone else. Really should be done all youth. You have opportunities when the youth is being processed, whether it's with families or unaccompanied, in the protocols and the different relocation centers where they're being processed, you have an opportunity just to ask a few simple questions. It doesn't add a lot, a time or effort on the part of the professional, but it really elicits very, very important information from that child. So a universal screening, depending on the score of that instrument, that can justify having a conversation, which we refer to as a brief intervention. It's a person-centered, motivational interviewing based type of dialoguing that you have with a child. And it's all about, elevating their awareness and helping them to consider, their risky behavior and what they would do about it. And so it's very much not telling them what to do. So one of the things as adults that we want to try to step back from is being directive. It's healthy not to do that as a provider in general, but it's really helpful not to do that with adolescents. Adolescents are used to hearing adults telling them what to do. Using this approach is more engaging. You're more likely to have a conversation that will reflect a lot of the challenges they have and form an alliance with them. And so if the screening tool indicates a score high enough where the person seems to reflect to be at high risk or substance use disorder, then we may need to make a referral for further assessment. Now, the components are specifically labeled as screening, brief intervention, referral treatment. Not necessarily saying in language, we're not necessarily verbalizing and telling someone, listen, you could probably benefit from going to treatment. It's more about saying, well, this says, it looks like you might be like going to another place and being assessed further might help you understand what options you have if you do, because it seems to indicate here that you have a higher likelihood of having substance use related problems. And so it's really important to understand and align our dialoguing, our language with the processes we're using. It also helps us to keep that Latino immigrant youth engaged. And so culturally informed environment, something to be really cognizant of, is the idea that for someone to feel comfortable, part of the time, what we want to understand is that the environment should be welcoming, that the environment should help them feel safe. Safety is always the first thing we think about with anybody we work with, but most importantly with the Latino immigrant youth, just coming off an arduous, really probably the most taxful journey they've ever had to take. And so the environment and safety is key. And so being trauma-informed is important, and being affirming and using preferred language. And so preferred language, when you think about the Hispanic cultural elements, and many of us are familiar with this is research-based. This goes back all the way to the cultural elements within Hispanic, Latino, and Latinx communities were first identified back in 1996. And there's two scientists who not only identified the behavioral characters, but gave it a label, and since then we've been building with that. and we'll be building off of that. So preferred language and cultural context is important. Latino clients will view a relationship as positive in part if it has some of these cultural elements, if we're engaging in that way. And it makes it more reciprocal. It makes it more likely that the other person will be more comfortable in speaking to you. And when we're referring to youth, when we're talking about adolescents, when you're talking about children as young as 13 coming into a country that they've not been to, this is so important to be able to engage them that way. So we know personalism is a big part of it, how it has an emphasis on being polite instead of being rude, if being courteous as opposed to expecting them to do what we tell them to do. It's a very different approach to being able to engage them. And so it helps you establish that personal connection. And so in Latino culture, we know we want folks to feel trusting. And so building and being confident with us. So confianza is really important to that trusting factor. And so in developing that. And that rapport can develop into a responsive, maybe kind of like a collaborative type of interaction where that person is felt like they are supported, like they can feel safe, like they're being spoken to in confidence, that their dignity is not being compromised, particularly for a 13, 14, 15-year-old with those development stages where they're at. That's extremely, extremely important. And so think about that. And I'm going to go through these I'm looking at the time. And I have quite a bit of information to go through. So if you want to add to this, please put it in the chat box, and my colleagues will also kind of help us get that information, and we can add it to the talking points that I'm presenting here. So 3 components. We have screening, we have brief intervention, we have referral to treatment. So the factors for screening in SBIRT has to do with what I've mentioned already several times, preferred language. If you, particularly for some immigrant youth, Hispanic immigrant youth do speak English. The thing is, do they speak English and comprehend? Those are 2 different things. The comprehension process is something that you have to work with. So I'm going to speak to about possibly some of the strategies that's going to help you with that. So preferred language, confidentiality, one of the best ways to really engage youth, in particular Hispanic, Latino youth who are not very familiar with how systems work and how the environment works here, is helping them understand what confidentiality is, so they can feel safe and comfortable enough to speak, be more forthcoming, and as honest as they know how to be with you. And so there's a universal approach to screening that we spoke about before, and there's certain screening instruments that we can speak to here. So, and there are different types of screenings, depends on your setting. Your setting, depending on your community, or if you were talking about Hispanic and Latino immigrant youth or a refugee population coming in, what you want to do is get a screening tool that is in the prominent or the prevalent language within that community, and ensure that it is one that is not overwhelming, that they can either self-report or you can do in a person-to-person interview. And so the screen interpretation is really important. You cannot really justify having a conversation or brief intervention because your gut tells you that they're using substances, that they're drinking. That's not how our processes work. It has to be a justification for that kind of documentation, for that kind of intervention. So the screening score is really important here. That is what would justify having a brief intervention. And then you want to be able to actually facilitate the screening tool exactly the way it was designed. So confidentiality here, what we do know is that, yes, it is one of the best ways to have a comfortable atmosphere, a safe environment type of conversation with a youth, if they know that what they share with you is not going to go anywhere. And so for Latino immigrant youth who are not necessarily sure how the environment works, how the systems work, who you talk to, who you don't talk to, who are already coming in, with their, just a heightened state of being traumatized and high stress and having to transition into this new environment, it's really important to help them feel safe. The confidentiality part helps them understand that they are not going to be reported to someone, that it would immediately mean that they have to be reported. So confidentiality explaining is really key. And so understanding what those protocols are, particularly in your setting, that's important. And so you should explain it and help them understand what that means, and that the only way that you will share with anybody, you will share with a family member that they may be traveling with, that you might share with a sibling that they may be traveling with that is older. It's only that might be over 18. It would only be if they're in danger, or they might feel, or they're going to hurt themselves or hurt someone else. And so more that what we've seen with the research is that when you explain the confidentiality and set the atmosphere, adolescents are more likely to respond. So conveying confidentiality, you find the words, but you want to do it in the language that they most understand. So one of the things you want to do is introduce yourself, create that comfortable environment by giving them a smile. Don't feel like you're hurried. Actually pay attention, help them feel like you're really there for them, that you're interested in them. That's part of it. And then you want to explain what confidentiality is and ask them to explain it back. These are some of the validated instruments. And we say validated because the way they've been tested and the outcomes, they have very high reliability in terms of identifying youth who are at risk of experiencing harmful consequences from their level of consumption. People have health issues, have mental health issues, have other type of psychosocial problems, and they may not be consuming at a level where alcohol use disorder or substance use disorder is actually, they may not even be meeting the criteria for that. So they may be in that grid, that progression, and that chart that I showed you. They may be in that midway, somewhere in the middle, where they don't meet the criteria for diagnosis, but they're certainly experiencing consequences because their level of consumption, their level of use. So these are really some really nice instruments that we generally, encourage folks to consider depending on the community. So the CRAP questionnaire is version 2. Let me just show it to you. Looks like, let me know, Anna, if, or Priscilla, yeah, I think I've got about 10 minutes, so I just want to make sure. So I want to run you through a couple of instruments. So the CRAF 2 is a really nice instrument, very specific to the adolescent and community. And when it's done, and when you have it in Spanish and different languages, possibly in different dialects, what you want to do is introduce the screening, present the confidentiality parameters, and then help them understand that ahead of time, before you even ask the questions, what different substances you are going to get ready to ask them. And ask them if they don't mind if you ask that of them, and let them know that you do that with everyone. Asking permission gives them not just autonomy, but it's very empowering for a Latino immigrant youth to be asked if whether or not it's all right with that to respond to questions. That can be an amazing point of rapport building. And also use the exact wording for the instrument, because the instrument is supposed to be, is designed so you can ask it verbatim. So this is before you start asking questions, you want to be able to build that atmosphere. You want to engage the person. You want to let them know what you're going to ask about, and let them know that, you can stop at any time. You can start again when they are ready. It provides some autonomy. It provides them a sense of respect, and they're being acknowledged, and they have a voice. And so all of that can be very empowering before you ask these questions. And so the first part of the question is, if there's no days of use, you just stop there. There are 5 questions. These are very situational. Okay, thank you, Anna. Yeah, these are very situational, and ask about, have you used marijuana, and have you had more than a few sips of beer? They don't seem as intrusive, beer, wine, and drink any alcohol, and you have other questions all the way there. If there's no days of use, you stop right there. If there is some affirmative answer for any one of these, you want to go on and ask the other questions. You also have some more simplified type of screening, which is is just a few questions where you want to ask someone, you said, in the past year, how many times have you used tobacco? And these are never, once, or monthly or weekly use. And you ask for the first 3 questions. If never, if they're all never, then you bypass the following questions. But otherwise, if there are some kind of questions that they're being affirmed to, you want to ask about how many times in the past year have you used prescription drug medications and illegal drugs. And so you have the grid here. What's really important is to know what the scoring and the interpretation is. And so here you see a grid, and this will be in your slides. And what you see is there's no use. You just affirm the happy choices, and you just accent that rapport that you have with the young person, and then and hopefully you get to see them again. And so once or twice a year, then you want to be able to ask the follow-up questions and then provide a brief intervention. Monthly use of the brief intervention, giving them, one of the things we want to remember, these are folks under 21. We're talking about 12 to 17 years of age. We don't encourage how to reduce consumption. We want to let them know, so I encourage you to actually not use and wait till you're older, and maybe there's some things that happen in your life, maybe we can talk about that. And weekly use of more, then you want to do a brief intervention. And in that same conversation, if it's a lot of times when someone is using substances and indulging quite a bit, that it comes out of conversation, and you're more likely to offer a referral for further assessment, and hopefully, and maybe potentially some help that they might want to consider. You want to bring in the parents to, or the guardian, to be able to help them make those choices. So the thing about screening is that your language should reflect that it's just screening. If I'm screening someone, I can't tell that child, listen, you have a substance use disorder, you probably need treatment. It's hard to justify that, so we don't do that. So even though the literally labeled component is referral to treatment, is actually referral for further assessment to a treatment facility where a credentialed professional can actually facilitate an assessment and then provide options should it justify it. So brief intervention is really about using motivational interviewing, which is a goal-oriented approach and person-centered approach to helping adolescents, have a conversation or discussion about their risky behavior. And so we are able within that dialogue to provide cessation advice without being directive. We can do it in a collaborative way where we can just have like a conversation. For teens who are not ready or willing to attempt to quit, reducing risk of behaviors may be a first step, but you want them to meet that person where they're at. Even though you recommend they shouldn't do it at all, you want to make sure that at the end of the conversation, can I meet with you again to be able to discuss this? And so some of the factors for brief intervention is using that screening score to justify the conversation, the MI skills, evidence-based practice. Many times it doesn't take more than 15 minutes or so, 15 or 20 minutes. And so sometimes when you have to have that conversation more than once, those are extended brief interventions. So this is essentially what it looks like. It's really about building rapport. And in that conversation, this is strategic. You can weigh out pros and cons in that conversation, provide information and feedback. There's also a way to assess whether someone is thinking about or is comfortable or has confidence or is ready to actually address a behavior that they identify. And you hope that what you end with is an actual action plan of what they're willing to do. And so this can happen when someone is when a Latino youth is being transitioned into the different American settings, their housing opportunities, and when they're setting up a school, or it can happen once they're already transitioned here and they're acclimating to the environment, and you check in with them. It provides a lot of information. So motivational interviewing has a lot of different parts to it. One of the basic things is just to use the ORs. Open-ended questions, affirmations, reflective listening, and summarizing. And this is the easiest thing to do. I only have a few minutes, that's why I'm kind of rushing a little bit. One of the best things about working with adolescents is how you can engage them and focus on different things. Part of it is strengths. So I noticed you're really good at identifying strategies to help you reduce stress. It's like helping that person feel empowered that they have the ability to make healthy decisions for themselves. You want to be able to encourage that they continue to address, the fact that they do acknowledge that they address issues that they have had. You did a great job dealing with the pressure from your friends to drink before when you made a commitment to cut back. Being able to hear that from particularly from an adult is huge. Making encouraging statements and elicit positive responses and acknowledging the positive. So you have some examples of that there. You also have some other examples here, like pointing out and celebrating steps that have been taken. You want to recognize and acknowledge adults that do this with youth have a higher likelihood of having a rapport of a healthy collaborative partnership, and more likely to be able to see the youth and they're more forthcoming with you than if you don't, as opposed to having other adults in their lives who tell them what to do. And so, and particularly in an environment that they're not used to being in. Remind the adolescent of the past successes and really acknowledge and compliment their willingness to talk about these issues and to address them and celebrate them as a person. And so reflective listening, listen to what they have to say. Today, we're not trying to talk to adolescents, especially the Latino immigrant youth. We want to be able to talk with. So reflective listening is key. And you also want to use the summarizing skills. And a lot of you understand that this is really about conversation that conveys support for the adolescent's autonomy. That's really huge. It's about advising them. You're able to advise them about what the potential risks of continuous substance use can do to them, and make it very relevant and tailored to their specific environment, and explore their ideas about these different substances, explore their ideas about their community and who they engage with and what school looks like and who are their peers, and also include information about vaping. You also want to share about the impact of substances and how it would impact their development as they grow older, since this is a country down there trying to stay in that they want to be successful in. So the last piece of this is making the referral. The referral is really for further assessment. It's usually, we refer to a credentialed person at a treatment facility, it tends to be there. Less than 3% of youth aged 12 to 17 in need of substance use actually receive it. And so how you actually facilitate a referral is pretty important. So think about this, what are the resources, your community resources who accommodate Spanish language, who are able to work with undocumented or immigrant youth who are transitioning. Understand what the cultural matching part of this is. It's really important to match with resources that are going to be more culturally and linguistically conducive. You know, part of the referral criteria that you use is the personalism. It's your way of engaging, your way of acknowledging who they are, giving them airtime for them to say what is on their mind, and you actually listening as opposed to interjecting, which is a little different than what they probably were used to while they were transitioning and traveling to this country. You want to be able, and usually the referral process involves, making that appointment right away when they're still more willing to, follow through, parental involvement or guardian involvement, being able to actually walk them over or accompany them to this resource where you're providing a referral to, and follow up. So lastly, what I want to finish with saying, and I know I'm just a minute over, is when you're considering referrals, think about the developmental processes with immigrant youth who likely have a higher likelihood of trauma, stress, and all types of experiences that they're presenting with. So there's mental health issues that they're likely there. So you want to be trauma informed. That's part of being culturally informed, is being trauma informed as well, because there's a high prevalence of these adverse experiences with this community. And so the willingness and ability to engage in treatment is part of what they will share with you in discussion. And so high-risk behaviors, all of these are part of the considerations that we want to take into account when we're making an appropriate referral. Make sure you have your knowledge base available, and make sure that you have options. And one of the best things that you could do when you do have these conversations, when you do screenings, is build on that relationship that you have with that young person, and let them know, listen, I'm going to check in on you within a week or so. Okay, so that way you can let me know. That trusting part is really huge. It helps for them to actually follow through. And with that, I'm going to leave it right there. And I am going to thank you to my colleagues for letting me go over a couple of minutes. And I'm going to leave it to you folks to ask questions.
We already have some questions here, Diana. The first one is from Digna Marrero. She's asking, I think that's just a comment, I'm sorry. Start by asking them the reason why they are not eating and what we could do for them, and can they help us make it better for them. So that was just a comment from her. We have a question from Alexandria Contreras. Is there a training needed in order to use SBIRT screening?
So thank you for asking that. I was going to mention it and I hadn't done that. Thank you. Yes. So depending on your credentials, there are for licensed social workers or master level social workers, for medical practitioners, you can do, some states require that you just do a 4-hour training. I'm an expert technical assistant implementation specialist. So what I always encourage providers to do is to take the 12-hour version. You have an opportunity to really know this like the back of your hand. You have an opportunity to look at it from a different perspective and actually practice the dialogue. So there are 12-hour versions, there are 4-hour versions, and sometimes you can have a resource, or like the National Hispanic Latino PTTC and ATTC can also tailor it with the hours for you, so you can have the skill sets and the understanding that goes along with it. So yes, training is very much encouraged and needed.
Then the next question, we are seeing more alcohol and substance abuse in our area, there in Wisconsin, among both youth and adults. And we struggle with where to refer families to. No treatment centers in our area have bilingual staff or someone they can go to that they trust or speak Spanish. What do you recommend in this case? We are a trusted resource center that serves Hispanic and Latinos.
I'm not sure what your capacity in terms of your community is, but one of the things that you do when you have limited treatment resources is like sometimes it's not the treatment that's needed. Sometimes you can mediate with a recovery support resource. First of all, you have peer coordinators or peer support specialists. You also have recovery support resources that can mediate before while you do get someone into treatment if that's what they need. But that might be enough to help someone change their behavior. So if someone needs to go somewhere, that's an opportunity. And sometimes we kind of think out of the box. If we don't have actual treatment facilities, then you may have to consider using perhaps a 12-step model. Look into your community to see what other recovery specific resources exist, and not just the traditional substance use treatment facilities if you're limited with that.
Okay. And another question is there training we can seek if we do not have the social worker or medical license?
Oh, yes. So you can, if you don't have the license level, you can go through a 12-hour version. You get the certificate, and the best thing about that is not only do you get your skill sets, but even if you did have someone who is supervising you, you could eventually actually not just do the actual practice, you can actually bill for it. So there's a 12-hour version for non-clinical providers that I would encourage you. I try to encourage everyone, even the clinical providers, to use that one, because that way everyone gets really extensive, really good in experience facilitating and experiencing and engaging in experiential activities, which is really key for this.
Thank you for that, Diana. And then I think this question is for us, but how are we able to get these slides later? These slides are very informative. You will be receiving the slides in an email that you will receive later with information on how to also complete our evaluation. So we will be sending those to you. They're asking, where do we find the 12-hour version?
So 12-hour versions. So you can make a request. I don't want to put anybody on the spot. Anna will let them yell over us, but you can actually request your local, PTTC or ATTC. Right now, this presentation comes from the National Hispanic and Latino ATTC, PTTC. You can make a request from them, and they can arrange for a 12-hour, or you can reach out to other organizations and request that your organization get a 12-hour presentation. These are not usually online modules. These are typically like for where I'm from, and I come from the East Coast. So what I do is I present them to organizations who have a certain amount of people. The National Hispanic Latino PTTC may be able to coordinate with some of these facilities. So you can follow up with them and they'll be able to give you more information.
Thank you, Diana. Okay, can we move to slide, I believe it's slide 66, please?
Okay. You sure is that it?
Yes, thank you. Here's our presenter's contact information. If we were not able to answer all of your questions, please do not hesitate to reach out to us or to our presenter. Diana was kind enough to share her contact information, and you can see it on this slide. Next slide, please. Please complete our, take 5 minutes and complete our survey. Your opinion is very important to us, and it also help us to provide these types of trainings for you in the future and continue to do this great work that we're doing. Next slide, please. We would like to share the information or contact information with you. Please feel free to connect with us. If you have questions or if you need any assistance, this is the information for the ATTC, the NHL ATTC. Next slide. Here is the information for our PTTC. Next slide, please. So thank you. Gracias. Have a lovely week, and we hope to see you again soon. Please be on the lookout for future trainings that we put out for our community. And thank you for being here this morning. We really appreciate you. Thank you. Have a wonderful day. Thanks, everyone.